Thank you, Rachel. Good morning, everyone, and thank you for joining us. I appreciate your patience over the last couple of days as we deal with this crisis at the Northern Correctional Facility in Newport. I'm going to make some comments and give you a timeline that we dealt with during the events leading up to the identification of the number of positives that we have. I'm going to give you some sense of what we're doing in response to that, and then I'm going to open it up to questions. So if you could hold your questions until Rachel starts facilitating that, I would appreciate it. Let me start by saying this. This is a significant and critical event, and it's requiring all hands on deck inside the Vermont Department of Corrections. It's very concerning to me as commissioner. It's very concerning to our staff. And I know it's very concerning to family members who have loved ones who are incarcerated at the Northern facility. So as the commissioner, I understand the significance, the importance, the impact of what I'm talking about today. I want to assure everyone that we're applying every resource, asset to address the welfare of our staff and the incarcerated population that we're responsible for. I want to be clear about our responsibility here. We understand our obligation to those who are in our custody. That's not lost on us. I will tell you that the senior leadership and those assigned to the overhead management team for this year-long response, because as a reminder, we've been managing this for a year now, have worked tirelessly to get our arms around the current situation in Northern. I want to call out the staff on the ground at the Northern facility. They have been working tirelessly since the beginning of this pandemic over a year ago. And as a result of this, are working tirelessly to get our arms around the situation in Northern. They come to work every day, expose themselves to danger, provide care, protection, and safety to the folks that are in custody there. I want to acknowledge that work that has been done and the work that is ongoing right now. To the families of those affected at Northern, I understand that these are your loved ones that are in our care. I want to assure you that we are doing everything we can and we are razor focused on containing this outbreak. We've been prepared for the last year. This is not the first time we've had an outbreak, both at Northwest in the spring and in Mississippi during the summer. And we're razor focused on trying to get our arms around this. Let me walk everyone through the timeline of the outbreak so there's a better understanding of how this unfolded and how we've gotten to where we are. A staff member who tested privately outside our testing protocols. As a result of that private test, that staff was positive. That staff was last in our facility on or about the 16th of February. This caused us, as a result of a staff member being positive, to go to our rapid responsive testing per our protocol in collaboration with the Vermont Department of Health. That protocol required us to test the entire facility, which we did on Tuesday, February 23rd. Those results came back on the 25th, Thursday the 25th, and indicated that there were 21 incarcerated folks positive and one additional staff member. The contact tracing team was activated and made efforts to contact trace the source of the entry of the virus into our system. We were unable to pinpoint that, which is unusual for us in our contact tracing. This left us greatly concerned about what we may be facing. Furthermore, the positive tests were in two separate buildings, and we were unable to explain how the virus moved from one building to another. In collaboration with the health department, our staff on the rapid response team, it was decided to retest the entire facility on Monday, March 1st. We started receiving those results late on the afternoon of Tuesday, March 2nd. This was an unusual turnaround. Normally, it's 2 to 3 days for us to get results back, but we requested to expedite those results because of our concerns. As those results started coming in, we realized that we had a large outbreak in the facility. We started taking steps to deal with that. As a result of that testing, we now know that we had 129 incarcerated individuals positive and 10 staff members. As we sit here today, we have 128 positive incarcerated individuals, 10 inmates. Let me be clear about that. We have 128 in our custody and 10 staff that are positive. One of the positives has been released with protocols to be followed as a result of their release. It was a scheduled release. As the results started coming in on Tuesday, we held our first collaborative meetings with stakeholders and partners to start moving resources and tap into our stockpile of supplies. We met with VitalCorp, our healthcare contractor, and put in place a plan to bring additional medical staff to the facility, to include contracting with an outside medical traveling service to bring additional RNs, LPNs, and nursing assistants into the facility to be able to schedule the proper resources. We also started looking for and moving further assets to the facility. We have, for a period of time, had a stockpile of supplies that we've been building for events like this over the past year. Let me run through some of the other steps we've taken. We've added medical personnel, as I've said. Our medical contractor has ordered additional medication ahead of time. We've split up and isolated those positive individuals and quarantined the non-positive individuals. And we've set it up as if it's set up as it's a hospital, as I said in the original press release, to include identifying the individuals that are high risk. We have ordered and are receiving O2 concentrators and hoping to have 34 of them on the ground by the end of today. We've stepped up mental health counseling. A concern for us always in a situation where we have a facility in a lockdown and individuals are isolated is the mental health well-being of those individuals. We have moved 60 new tablets. Inmates are given tablets. We've moved 60 more tablets to the facility, hoping that every individual will have a tablet, which will help communicate with their families. We've activated our victim services unit and to staff our Office of Contingency Services in order for families to have direct contact. They've split up the list of positive incarcerated individuals. So there is one person assigned to a group of families that they can get information from us on a regular basis. We've stepped up our supply of fluids, including Gatorade, water, and directed the kitchen staff to start making such things as soup ahead of time, in anticipation of people become ill. We've coordinated with hospitals in the area, the potential transportation of people out of the facility. We are going to be staging ambulances at the facility in anticipation that we have to move people quickly out of the facility. We do believe that we can manage the healthcare of the facility just like we did back in the spring of last year at St. Johnsbury when we set up the surge unit there. We also will have a doctor on site 7 days a week, 12 hours a day, and the other 12 hours a day, we will have doctors on call to be able to manage any medical situations that come up with the nursing staff that will be on duty. With that, I'm going to open it up for questions and any comments that folks may have. But before we close, I want to just finish up by saying we are testing the facility again today. The positive folks will not be tested again, but anyone who is negative will be tested again today. We discovered this outbreak, unlike some states that wait to test until symptoms, as a result of well-tested protocols we put in place over a year ago. We test to suppress. We've been through this before, obviously not to this extent, but I'm confident in the staff and the plan we have in place that we're going to manage this. And we all hope and pray that the individuals that are positive stay healthy. To give a sense of the amount of testing doing, we are doing 1,800 tests across the system this week, to include the facility in Northern. So with that, I'm going to turn it back over to Rachel and open up the floor for questions.
Thank you, Commissioner. I will go in the order of RSVPs. And again, if you don't have a question, just say no question. So starting with Derek from the New York Times.
Hi, Derek. Welcome to Vermont.
Thank you so much. I've been several times and I love it. More than several. Thank you for taking the time to do this. I know you said that you kind of contact tracers kind of lost track and couldn't find out where it jumped from one part of the facility to the other. But I'm curious if you have any specifics or details that kind of led up to that. I mean, do you know how it started to spread from that initial person? And then very quickly, secondly, I'm just wondering if staff members that are tested on their own in their free time, are they required to report to you guys their test results?
Let me answer the first part of that question, Derek. I forget exactly the wording you used, but we still do not fully comprehend or understand how the virus got inside the facility. Our protocols here in Vermont have locked down the facilities pretty well on quarantining individuals into the system. It's our experience that in the majority of the cases where we've had positives, it's either someone who enters the system or it comes in through a staff member. We are still not sure how this chain of events started. In particular, how it got from one building to another. The contact tracing is ongoing in collaboration with the health department and our contact tracers and our incident command overhead team that is managing the incident. The second part is that I don't know if we require staff to notify us, but staff does notify us about when there is a positive. The staff has been very good about that, and they've worked very hard to keep the virus out of the facility and away from their coworkers. Derek, did I answer your questions?
Yeah, thank you.
You're welcome.
Thank you, Derek. Next, we have Jim from the Valley News.
Hi, Jim. How are you?
Hi, good morning, Commissioner. Yes, can you hear me?
I can. Jim.
Yes. When do you anticipate you can start vaccinating offenders in the Vermont? And can you also give me an update on how the vaccination is going in Mississippi?
I can. We have started vaccinating inmates in Vermont. That's been going on for the last couple of weeks. We're following the same band that are in the public that the health department has set. So we have vaccinated individuals in our facilities already with both Moderna and Pfizer. So as of right now, 17 individuals who fit into those categories have been vaccinated. We were set to vaccinate the band of incarcerated individuals at Northern, I believe yesterday, but we had to cancel as a result of the outbreak. And so we anticipate that I believe it's 20 individuals will be vaccinated in Southern State on Monday of next week. And in Mississippi, if you just bear with me a minute, 72 of our out-of-state population have received their first dose of Moderna vaccine in Mississippi. Does that answer your questions, Jim?
Yes, just a quick follow-up. Do you know how many in Mississippi have decided not to get the vaccine? Because I hear that's an issue.
I believe, and we'll have to get back to you to confirm, but I believe everybody agreed to take the vaccine there except for 2, I think is the number. But we will confirm that with you. Rachel, do you have that information in front of you?
Yes, sir, I do. We had 6 refusals, and those people will be circled back with after those who originally agreed to the vaccine to give them the opportunity again.
Thank you, Rachel.
All right. Thank you.
That helps. Does that help, Jim?
Yes, thank you very much.
Thank you, Jim.
Thank you. Okay, next we have Tim from Vermont Business Magazine. Tim?
Good morning, Tim.
Hey, Commissioner, how are you?
Well, thank you.
That was a busy time for you. I was curious that you mentioned in the opening remarks that the one staffer who tested positive did so outside of your system, which suggests that he was concerned that he was already sick. And so why did he go outside the system? And maybe a little bit of the backstory on that and why he didn't go through the usual protocols in your office.
Throughout this last year, Tim, it's not unusual for staff members who may think they have symptoms to go and get tested on their own. That's happened many, many times in the last year. They would get tested because in between testing the facilities, because at one point we were testing staff every 6 weeks. We test staff now every 2 weeks. So it's not unusual for staff to go outside. I never probe past that, Tim, just out of respect for their privacies about why or what their symptoms were. But, that's the best I can answer on that one.
Well, the suggestion is that perhaps this was the entry point, that this staffer might have been the entry point for the larger outbreak.
Well, Tim, I'd be really careful about making that suggestion because if we thought that we could have pinned that down, I'd be saying it now. I want to reemphasize that we are struggling to figure out through contact tracing exactly what happened here. I'd be careful about making that assumption.
Okay, thanks. That's all I have. Good luck.
You're welcome. Thank you, sir.
Thank you, Tim. Next up, we have Caledonian Record, Todd Wellington.
Hi, Todd. How are you?
Star 6 to unmute.
Can you hear me?
Hi, Todd. How are you? Hi, Todd.
Hi, can you hear me, Commissioner?
I can hear you, Todd.
My technology is just really bad. Commissioner, due to this outbreak at Northern State, are there any plans to reopen the surge facility at Northeastern Correctional Complex in St. Johnsbury?
Not at this time. There is not. We believe we can, because of the size of the complex in Northern, we believe we can handle it on the ground there.
So you can quarantine 100 inmates?
What's that again?
So you can quarantine 100 inmates at Northern State?
Yeah, that facility, the population at that facility right now is 349. It's a fairly large facility, and we believe that we can handle it on the ground there without having to move people.
Thank you, Commissioner.
You're welcome, Todd.
Thank you. Next, WCAX, Christina.
Hi, Christina, how are you?
Hi, how are you?
I'm well, thank you.
Thank you so much for talking to me. So first I wanted to ask, this exponentially spread in just a week. It went from, like you said, 22 to about 140 in just a week. How did it spread so quickly? I know you had said we don't really know exactly how it started, but what measures were taken to mitigate the spread and why didn't they work?
Well, I wish I could answer that right now, Christina, but I can't. I don't know. And that's the subject of the contact tracing and the work that we'll be doing with the health department. Just like when we had the outbreak in Northwest in April and we were able to contain it, that work that we did there after the fact actually became some of the work on the national level for changing some standards. And so we plan on doing the same thing here, trying to figure out why it spread so fast. We don't know right now. And, we're in the process of reviewing that. And unlike some of our other outbreaks where it's 5 or 6 or 10, it's easier to do contact tracing than when you're trying to do contact tracing for 129 incarcerated individuals and 10 staff members. So I don't know at this point in time.
Okay, thank you. I just have one quick follow-up. Is there
Sure.
reason to believe the outbreak could spread into the community, or has it already?
I don't, again, know how to answer that. Obviously, we have staff that comes and goes from work. I will say this, the mere fact that we have this small number of staff members positive at this point in time is an indication that our staff is doing what we've asked them to do over the last year, which is to be very careful about PPE in the facility and follow the protocols we put in place. That number's down. Now we'll see what this test reveals today, and we'll certainly make all of you aware of what we find out from the test. But my point is this: the way it'll go to the community is for folks that come and go from the facility. Right now, it's staff, and we don't have that large number of staff. I will say also, Christina, that community spread plays into our ability to be able to keep the facility safe.
Okay, thank you so much. That's all I have.
Thank you.
Yes, thank you. Next, WPTZ, Matt.
Hey, Matt, good morning.
Good morning, Commissioner. Can you hear me okay?
I can hear you fine, Matt.
Perfect. Thank you very much. 2 questions for you. One, you alluded to the number of staff, the low number, but of course the inmate numbers are extremely high. Can you talk about when the inmates are congregating together, are they required to social distance? Are they required to wear masks? Could that, could have or not have prevented such the rapid spread of this? And the second thing is, out of these almost 100 and nearly 130 inmates who have tested positive, are any experiencing severe symptoms? Can you talk about the symptom levels these inmates are facing right now?
So Matt, I'll start with the second question first, if that's okay with you. As of last night, I did not get a report this morning, but as of last night, no one is symptomatic. We have no one that is symptomatic. I'm waiting for an update this morning on that, and I'll be getting updates moving forward twice a day on that, especially around temperature and O2 saturation, which are 2 things that we monitor very closely. The first part of your question is that everyone knows it's difficult to social distance inside correctional facilities. We've done a lot of work with everyone in the system, the criminal justice system, over the last year to lower the number of people that are in custody to try to cut down on close distance. But I think it's safe to say, just like out in the public, people don't always follow the rules. And I'm not saying that has something to do with this, but it's something we have to look at. We have to pay attention to. So right now, I can't give an affirmative answer if that contributed to the spread inside the facility.
Great. And one follow-up question. It was announced earlier this week that corrections officers will be eligible for vaccination. Just your reaction to that as the commissioner.
Yeah, thank you for asking that question, Matt, because I want to clarify something that I've read in newspapers in the last 24 hours. The conversation about vaccinating the security staff inside the facilities have been going on for several weeks. And we learned at the beginning of last week, to be specific, Tuesday night, when I received a phone call from the Deputy Secretary of AHS, Jenny Samuelson, to indicate that we were ready to move to vaccinating security staff. We had been working on that for a period of time, and there has been some indications and some statements made by people in the newspaper that somehow the governor announced that on Tuesday with the knowledge that we had this outbreak. That's not true. That is absolutely not true. And we had started meetings last week. And really what was the tipping point for us to get in line to get vaccines for our security staff was the release of the Johnson & Johnson vaccine and the bump up of the amount of vaccine coming into the state. So I expect this weekend we will start vaccinating our staff. And as the ban's announcements come out, that will speed up the vaccination of the folks that are in our custody as well. Does that answer your question, Matt?
It does. I appreciate that. Thank you very much, Commissioner.
Appreciate you. Thank you.
Thank you, Matt. Next, we have the Barton Chronicle. Joseph Gresser.
Good morning, Commissioner. Thank you for taking the call.
I didn't catch your name. I'm sorry. I didn't catch your name.
Joseph Gresser.
Joseph, how are you?
So far, so good.
Good.
I am curious. You spoke about your surprise at the movement of the virus between two buildings. That suggests that you had some kind of isolation protocol in place. And could you give some sense of what that has been?
There's different terminology here, and I'm trying to translate the terminology to corrections terminology. But I think I'm not surprised. I'm not surprised that it isn't because of that I'm surprised it went from building to building. I'm surprised because of the way movement happens at the facility. I believe that we were in, as a result of the positive test, we were in a lockdown, which means the movement of the population was isolated. Is Chief of Operations Cormier on, Rachel? Chief, are you there?
Yes, sir.
Yes, I'm here.
Chief, am I correct in that we had, leading up to the testing on Monday, we had the facility in lockdown as a result of the other positives, correct?
That is correct. The facility had gone into a full lockdown as a result of the initial 21 positive cases. So that adds to the perplexing situation as to how did this transmit.
So Joseph, I think, thanks, Chief. I think that answers your question. Is that what you were looking for?
I think it was. I had one other question, and that is, I think you've spoken before about the kinds of health problems that many of the people who are incarcerated already have. Do you have a sense of the percentage of people in your care who might qualify under the band that includes people with underlying health conditions?
Yeah, I don't have that exact number right now. Staff is working on that for the purposes of planning the vaccination. But I will tell you, the band of 18 to 65 with chronic conditions is going to pick up a pretty good chunk of our inmate population because of those chronic conditions such as coronary related issues.
Thank you very much.
You're welcome. Thank you.
Thank you. All right. Next, we have Fox 44 ABC 22.
Good morning, Commissioner Baker. This is Courtney from Local 22. Hi. Good, thanks. How are you doing? So aside from symptomatic or symptoms in inmates, can you just talk about how they're doing? You know, are spirits down more than usual? You mentioned mental health is a concern when you guys go into full lockdowns like this. So just talk to me about how inmates are doing right now through all of this.
Yeah, you know, I want to talk, I'll talk in general first, Courtney. This has been a long year for everybody. It's been a long year. These facilities have been in and out of lockdown. They've been in modified lockdowns. The staff is tired. The leadership is tired. And quite honestly, the inmate population is tired. Their loved ones are tired of wondering what's going on inside the facilities. And as the commissioner, I'm very concerned about it. First of all, I'm concerned about my staff. I'm concerned about the wear and tear on them that we've been through. And I'm concerned about the well-being of the incarcerated population because of this wear and tear. Now, it's known that, you know, we recently had a suicide. We had an attempted suicide back in July. And we're taking a look internally at that right now. And I think we're going to be coming up with some recommendations moving forward. I've asked the mental health staff and our medical team to take a look at it. We're working on it now. I would imagine right now in that facility, people are wore down. And, you know, we're going to do the best we can to make sure they got contact with their families. And we have mental health folks checking in on them to make sure they're doing okay till we can get this cleared up. So I don't know specifically in the facility right now. I'm talking in general what I know about what's going on inside the system right now. Does that help, Courtney?
It does. Thank you.
You're welcome, Courtney.
Thank you. Next up, we have Liam Elder Connors, VPR.
Hi, Liam.
Hi. I'm wondering if this experience and this outbreak you're seeing right now has made you, I guess I'm wondering, are you considering advocating for the rest of the incarcerated population in Vermont being prioritized for a vaccine outside of the age banding protocol, just vaccinating all people who are in the state correctional facility?
Look, I've been in the conversations about the vaccination now for weeks. And I do think with the additional allotment of vaccine coming into the state, that the vaccination of the inmates will speed up. You know, other than that, Liam, I can't comment further on that because those conversations are ongoing right now.
I'm just wondering, I mean, but are you advocating for moving faster than the age banding allows? I mean, with the increased vaccine, I mean, we're seeing how quickly the virus spreads we know how quickly it spreads in congregate settings, and there's many that have underlying conditions, and just wondering if that's something that you're advocating for in those meetings.
Yeah, and I'm not trying to dance around the question here, Liam, but let me tell you this, that as the Commissioner of Corrections, I'm advocating all the time for our system. And so that conversation is ongoing, but so isn't everybody else out there. Teachers, business owners, daycare centers, everybody's advocating. And the challenge is we've got to get more vaccine into the state. And that's starting to come. So the conversations are going to get a little bit easier. I anticipate within the next 3 weeks, with the bans going where they are, we're going to pick up a big chunk of the incarcerated population, along with our staff being vaccinated. And we'll have a high percentage of individuals inside the system vaccinated.
Thank you.
You're welcome, Liam.
Thank you, Liam. Next up, VT Digger, Alan Keyes.
Hey, Alan, how are you?
Good, Commissioner. Thank you for taking the time. Will you be vaccinating contract employees along with the state employees who work in each of the correctional facilities?
I'm going to have to get back to you on that, Alan. I think I know the answer, but I'm going to have to get back to you on that.
Okay. And earlier when you were talking about the timeline, you mentioned that the first staff member got tested on the 16th of February?
I didn't say he was tested on the 16th.
Okay.
I said he was in the facility on or about the 16th.
Okay.
I don't know what the date was that person was tested.
Because I was wondering when he was tested and when the results came back for that person.
I don't know when they were tested, but the results would have came back sometime within that couple days of the 16th, because that's when we moved to the first round of testing. I think I said it was on the 23rd. Is that correct, Rachel? 23rd. So I don't have the exact dates on that, Alan.
I guess I was wondering about the gap. How soon after you got that first test result back did you do that testing on the 23rd?
Well, the first thing that happens is our rapid response team gets together and does contact tracing to figure out when were they in the facility last, and then put a plan in place to deal with it. So I can't give more clarity to that. Again, I think it was very close to the 23rd when we learned about the positive, but I'll do the best I can to get that information and get it back to you.
Okay. And you mentioned the fact that there's 2 buildings. Can you describe how many inmates are in each building? I'm not familiar with the setup.
Yeah, I think again, I may misspeak, so I'm gonna call upon Chief Cormier, who is much more familiar with the grounds there than I am. Chief.
Yeah, thank you, sir. The 2 buildings that we're using for quarantine and isolation right now each hold 72 inmates apiece.
How many buildings are on the site? I guess I'm a little bit confused. I'm sorry.
Well, we have trying to picture it out in my brain here. I think there's 6 buildings that eat for living unit space, and we have, as the commissioner stated, we have a total of 349 inmates on site today, and then we've been able to break up the quarantined inmates and the positive inmates into those 2 72-bed units.
So out of the 6 units, how many had positive test results?
All but 2 units had positive test results.
Okay.
Ellen, does that help?
Yes. And you'll get back to me with the question about the testing.
The contractor, right? Yeah, I will.
The contractor.
I can say, based on the working that I'm doing on the vaccines, contractors are not part of the identified population.
Why not? If the idea is to create the perimeter to protect the inmates.
A lot of our contract services have been suspended, Alan, as a result of the ongoing outbreaks. So right now it's the ones that are specifically inside those buildings working with the population.
So if a contract worker works inside the building, would they be tested or they would not be tested?
Tested or quarantined or vaccinated, sorry.
Oh, sorry, vaccinated, I'm sorry.
There are some exceptions with some of our probation and parole staff that are working overtime inside of our facilities on a regular basis. So those are a case-by-case basis right now.
And how
Alan,
many,
could you give an example? I mean, you're talking contractor here. You obviously have an example in your head. Could you give us an example of what you're thinking?
well, I was thinking first about medical people. Are there people who work in
Medical people have been vaccinated.
mental health counseling, people as well as, is there other contracted workers in like food service, janitorial work, that kind of thing?
No,
those are all state employees.
Right.
Okay.
So just to be clear, Alan, because that's why I asked you the question about what you were referring to for contracted. Yes, the medical staff is contracted, but sometimes when someone asks us, we consider them as part of staff. That's just the way we talk internally. So just to be clear, anybody that's working inside the facilities right now are going to get vaccinated. We've cut down on the number of contractors that we're allowing in. That's been like that for a period of time. Does that help with the question?
So just anybody who works in the building, even if they're not a state employee, would be vaccinated.
Anybody that's in the building regularly. So for example, healthcare providers are not state employees. They're vaccinated, yes.
Thank you.
You're welcome, Ellen.
Thank you, Ellen. Next, we have 7 days, Dave Graham.
Hi, Dave. Dave, are you there?
Star 6 to unmute.
Got it. Yep. Can you hear me now?
I can hear you, Dave. How are you?
I'm doing well. How are you, Commissioner?
Well, thank you.
Let's see. So we have folks who are locked up against their will, obviously, in our correctional facilities, in state custody, completely in your care. And I'm just wondering, I've been a little surprised over time that hasn't really come up that much in the context of, who's in the queue to get vaccinated. Do you think there's an argument could be made that there's a sort of a moral obligation to maybe start with the people who can't walk away? Even the corrections officers and other staff there can stay home if they feel like they can't go to work because of COVID risk. The inmates are in a different situation, and I'm just wondering, has any thought been given to this issue of them being in the state's custody 24/7 and really unable to mitigate their own risk in terms of who's first for vaccines? I mean.
Yeah, well, Dave, I think you used the word moral obligation. Was that the word you used?
Yes.
Yeah, look, Dave, I'm the Commissioner of Corrections, and if you read the statute, what it says is that people are in my custody, and I take that really serious. And so, getting back to advocating, and this is not, I don't want this to sound like this is adversary, but I've been advocating for many weeks, and we've been working on this for weeks. And the inmate population did get started to get vaccinated, but with a limited amount of vaccine coming into the state originally, and now that's changed. So our approach is changing. You had to follow the data, and the data was where people were dying. And so I've been advocating. We've been talking about it between myself and staff inside AHS, Secretary Smith. And now that the vaccines are starting to flow into the state at a higher number, we're going to get to those individuals. And quite honestly, we didn't have the statistics to vie for the limited amount of vaccine that was coming into the state because the staff had done such a good job of keeping facilities clean. And so I don't know how else to answer that besides to say that there's a lot of moral obligations about other folks that are in care at different locations that can't leave, the handicapped, and who's in line to get the vaccination is a very difficult conversation. It sounds easier than it is. And we've been talking about it for a period of time, and now that the vaccines are coming into the state, we're going to be able to adjust our approach. And as I said earlier, I'm optimistic over the next several weeks that a big chunk of the people inside the system will be vaccinated.
Okay, thank you.
You're welcome, Dave.
Thank you. Next, we have Burlington Free Press, Liz Murray.
Hi, Liz.
Hi, Commissioner. How are you?
I'm well. How are you?
Doing well, thank you. I just wanted to clarify, you said that the facility went into lockdown after the first positive tests came back. What, if any, other steps were taken to mitigate the spread after those first positive tests?
So the lockdown isolates the move of folks inside the facility, and we kept up what our protocols are, which is cleaning, mask wearing, and so on. And those were the protocols that were taken. Now, when that's the first test, I'm assuming you're referring to the staff member, the first single test.
I was actually referring to after the 20 came back, the 20-ish inmates.
Yeah. So once those came back, and and I can tell you, at the staffing meeting where this happened, we all agreed that we had this pit in our stomach that something didn't feel right here. And in fact, I notified certain people within the system that I thought we had pending a major outbreak. That's when we buckled down the system, locked it down, did our best to step up the cleaning. But at that point, as we know now, the spread was already starting to occur.
And so the additional measures that were taken only occurred after the 100 or so tests came back positive, the bringing in more medical personnel, et cetera.
Yeah, because we now know that we've got a major outbreak, and we've got to bring those resources in because we know what the numbers are now. We've had a pretty steady protocol for the last year on how we run the facilities. So changing anything after the first 21, lockdown is our protocol to isolate the movement inside the facilities, and then continue with the rest of our protocol, which is keeping facilities clean and wiping down things such as med carts and food carts and so
on. Okay, thank you for clarifying that. I appreciate it.
Thank you, Liz.
Thank you. Next, we have Ed Barber from the Newport Daily Express. Ed?
Good morning, Ed.
Yeah.
Are you there?
A couple of questions. I just want to clarify on the numbers that there originally was 21 people who tested positive, and now there's 128 at the correctional facility in Newport, or is that across the state?
No, that's 128 at the facility in Newport.
Okay, now let me ask you another question. I live on a dead-end road in the middle of nowhere, and it happens to be that I have several neighbors that work at the correctional facility. How are we protected from having the virus spread from the correctional facility into the community? I know it's not an easy question, but how can we be protected from them?
The same way you would be protected walking around any community where you wouldn't know if somebody's a carrier or not. And the guidance has been pretty clear. Wear a mask, wash your hands, social distance. Don't gather in large gatherings. The virus can't be spread by just neighbors living on a street.
Fair enough. Thank you.
You're welcome.
Thank you, Ed. All right, and it looks like our final question is Associated Press, Lisa Rathke.
Thank you. Hi,
Lisa.
Commissioner.
How are you, Lisa?
Good. How are you doing? So I don't want to belabor the point, but you said you've been advocating for weeks for vaccines for inmates. Is that a couple of weeks, or how long has that been?
When I say advocate, it's like everything else, Lisa. It's the conversations that go on amongst the commissioners in AHS, and I don't want to make it sound like it's other than raising the awareness of when can we get in line to get the virus, get the vaccine. So those conversations have been going on about vaccinating the facilities. I'll just give you a guesstimate, and please don't hold me to it. It's for about a month. And okay. Once we knew the Johnson & Johnson vaccines were coming along, and I want to remind you, the inmate population was involved in the ban conversation from the get-go. We had started, and I just want to be clear with everybody about this. We had started that vaccination with those individuals, just like we were vaccinating other folks at high risk in communities.
Okay, so you were just making aware, wanting to know when inmates would be coming along when you say advocating.
Correct. It's more like we were working, understanding when the vaccine was coming, and making sure we had a plan to start moving it into the facilities.
Do you think that inmates should have been vaccinated, should have gotten a priority?
Look, Lisa,
Yeah, right.
Lisa, look, everybody should have got a priority. Let me reemphasize this again, because I think it's important. It's, I remember as a captain in the state police back in the late 90s, doing a tabletop exercise about a pandemic outbreak in the late 90s. And one of the issues that came up was the ability to vaccinate and all the things that we're seeing now. Who would get the priority and how those decisions were made. And they're not easy decisions to make. Do you give someone, if you've got an 80-year-old grandfather in a nursing home, should I be giving it to somebody else or your grandfather first? Those are the decisions that had to be made. And I support the decisions that were made. I advocated for my shop. And as a result of that, we figured out when the vaccines freed up. And now we're starting to move forward with that. I mean, I hope that helps you clarify that.
Yes. Thank you very much.
You're welcome.
And then can you say what sort of age range the infected inmates are, the ones who have tested positive?
I don't know that. I suppose I could get that information if you really needed it, but I think it would take a little bit of work.
And you said that you're working on identifying high-risk people now?
Medical staff is identifying those because of their pre-existing conditions that are at the highest risk of having medical conditions or could get sick as a result of their underlying conditions.
Okay, thank you very much.
You're welcome.
Thank you so much, Lisa. That does bring us to the end of our queue, but are there any other members of the press on the call that have questions or any follow-ups at this time?
Well, Rachel, there's not. I'll wrap this up, okay?
I'll just briefly, Commissioner, this is Liam from VPR. I'm wondering if in the contact tracing that you're doing, if part of that also involves seeing if COVID mitigation protocols were being followed, like, staff masking in the facility and things like that.
Yes. So that is part of it, Liam. We have video. Many times contact tracers do interviews. They watch video. You can imagine the complexity of 129 positive incarcerated individuals looking at video and trying to figure it out. But also we have an auditing person that's been auditing protocols over the last several months to make sure that we were following protocols. So that'll be all part of the contact tracing as we move forward. Try to figure out how we got to where we are.
Great, thank you.
So is there anybody else, Rachel?
Anyone else who has questions, please feel free to raise your hand. Also, just an update on the current population count at Northern State. The incarcerated population at Northern State today is 343 individuals.
So let me wrap this up by thanking everybody. I always appreciate your professionalism, and I think this is the best way for us in a situation like this to get you the information. I know several of you were trying to talk to me yesterday, do interviews. I apologize. I just thought the best way to handle this is trying to jump from interview to interview is to meet with all of you at once and provide the information. What I will promise you is that we're doing testing today, and we'll start getting results back probably, if we're lucky, tomorrow night, Friday night into the weekend. As soon as we know what we have, we will update you. And once we get through the weekend, I will probably look forward to doing another presser with you early in the week to update you where we are. But if something breaks in between now and then, Rachel will be getting a press release out. So again, thank you very much for your time, and I hope you all have a great day.